we are on it. Okay, you should be able to hear me now. I need my microphone to charge a little bit first. Okay. All right. All right. Well, I've got 60 questions, mixed set. All right. So we can just jump into it. A couple housekeeping things. Just if you are interested, we do custom study plans. You can find that in the link in my bio, and also the free NCLEX Vault as well. So we're going to jump in. If you haven't already, go ahead and share the live, and let's jump in here. So okay. So I've got 60 questions, varying degrees of hard. These first 10 should be generally, they're supposed to be easy, basic recall type stuff. All right. So we can go through. I'd like to do, we're going to try to get through 60 in an hour. After each 10, we will do a little like refresher for the group that maybe just came in. All right. All right, let's jump in. Question 1. Here we go. It's on the screen. Drop it in the chat. What do we think is going on here? Clear liquid diet. Which option's correct? All right. Are we talking orange juice pulp, black coffee, cream soup, or ice cream? Okay. Again, this should be a basic recall question here. All right. So if you've anybody want to take a stab? We're just going to keep it moving through these, at least these first 10. We'll talk a little bit more in depth, but here we're talking black coffee. Okay, it's the only one that's transparent, doesn't contain any fat. All right, solids or pulp. Okay, so let's go through. Nope. This is the, we're just going to, might take me a little bit of time to get used to the features here. All right, so let's go question 2. Jump into it. Which client do you assess first? Post-op hip, mild pain, COPD, with an SpO2 of 89, child with fever of 101, or a patient with new confusion. All right. Yeah, we see a couple Ds. Yep, okay, beautiful. Patient with new confusion, because when you're looking at these questions, you're looking at what is not expected, right? So a patient with new confusion, there's those keywords: sudden, new, post-op day 1, those types of things. We are, we just gotta zone in on those. COPD of SpO2 of 89%, that's mildly expected. All right, let's go question 3. All right, here we go. Patient with C. diff requires what type of precautions, guys? C. diff. Oh, good old C. diff. Yep, okay. Definitely we are going into contact. It's not droplet, it's not airborne. And why is C. diff going to be contact? Because, well, it's contagious and it has spores. And so the other thing with C. diff is you got to clean it with bleach, right? You can't use your purple wipes. All right, so that was 3. Question 4. Which lab value here is most concerning? All right, I'll give you a second. What are we saying? We're seeing a bunch of A's, right? Because sodium 135, that's normal. Calcium of 9 is normal. Mag of 8, 1.8. But yeah, that potassium, because potassium pumps the heart, right? Potassium pumps the heart, and its value is 3.5 to 5. All right, and those varying levels can cause life-threatening dysrhythmias, respiratory compromise. All right, so they need to immediately start replacing that. All right. We're at 9:35. We're on question 5. Beautiful. We are right on track, guys. All right, question 5. Which action prevents aspiration in a tube feed patient? All right, let's see. What are you guys thinking here? Question 5. Lower the head of the bed. Stop feeding during repositioning. Check cap refill, or give extra water flushes. All right, I'm seeing a few B's. Good. Yep, definitely. We're going to stop the feeding before repositioning, prevents like that regurgitation and aspiration. Those are major risks in tube feed clients. Okay, so question 6. We'll jump in here. Which vital sign is most concerning post-op? Heart rate, 92, temp of 100, respiratory rate of 8, or blood pressure of 138, 80 over 82. All right. Okay, awesome. I'm seeing a lot of correct answers with C. For sure, that respiratory rate, because we know our regular respiratory rate is 10, anything generally 12 to 20. So especially post-op, like have they not woken up yet? Or they still have some sedation effects, or is there something more nefarious going on, right? All right, question 7. And again, these first 10 questions, guys, are basic recall questions. There should not be a whole lot that's tricky here. All right, what is the antidote for opioid reversal? Okay, yes, it is going to be naloxone, or otherwise called Narcan. All right, vitamin K, that's going to be for your coagulation. Okay, not for opioids. Okay, think people coming in with overdose of heroin or fentanyl, or over sedating. You accidentally gave too much morphine to a client who's already sleepy. Okay, and you knock them the hell out. All right, question 8. Which patient can you assign to the LPN? All right, you're going to see a lot of these delegations, scope stuff on the NCLEX. So which of these are you going to give to the new, or not the new LPN? Right, it's not going to be a new post-op because you might have unexpected changes there, right? Not new stroke symptoms, not chest pain. Okay, the key word here is stable and chronic. All right, because stable means there shouldn't be anything unexpected happen. Chronic is something this person has been dealing with for a while. It's not new. Okay, so yes, question 8, C, stable. All right, 9. Which newborn finding is normal? Cyanosis of the hands and feet, grunting, nasal flaring, or retractions? Question 9. All right. Which is normal? Okay, getting a few different answers, A and D. Right, okay, right. Acrocyanosis is actually an expected finding in the first 24 hours as a newborn circulation adjusts, okay? It does not indicate respiratory distress, and B, C, and D are all signs of neonatal respiratory distress and require immediate evaluation. All right, so good to go. Question 10. This is the first of the easy, well, no, I lie. I separated them in the blocks of 20. So these first 20 should be fairly straightforward. All right, which oxygen device delivers the most precise FiO2? Okay, yep, guys, definitely. The Venturi mask uses entrainment valves to control that exact oxygen concentration, which makes it ideal for COPD patients and anyone requiring strict FiO2. All right, so pause here briefly. Just wanted to point out, so after each 10 questions, we'll kind of welcome in the next group of people that haven't started with us. But I'm Nurse Jimmy, an ER nurse, and helping you guys pass the NCLEX, get across the finish line, right? Hardest thing you've ever done is go to nursing school. If you're studying for the NCLEX, I offer a few things in the link in my bio, custom study plans that are tailored to you, your time, your resources, the amount of time that you have to study, all that's in the link in my bio. Also is a free NCLEX Vault. It's over 250 pages now of cheat sheets on every single topic you can imagine. It's all in the link in my bio, and after each section is a 25-question mini test. All right, there's also a strategy guide in there as well. So with that being said, go ahead, tap all 35 of you. Holy crap, there's 35 in here now. All right, awesome. So just hold your finger on the screen, like that live, share it, and if you haven't already followed, give me a follow. All right, guys, let's jump back into it. We are, let me find question 11. Thank you, Tima, for the rose. All right, question 11. Which action comes first for a patient with suspected stroke? Let's jump into it, guys. What do we got? What do we got? All right, I see a B, a C, a D. Oh, you guys are all over the place here. Which action comes first for a patient with a suspected stroke? Okay. You said B, C, and D. Okay. Think of it this way. All right, well, so the correct answer here is B, okay? Hypoglycemia can mimic a stroke, so we need to rule that out first, okay? Because hypoglycemia, you think of somebody who looks kind of drunk and sleepy, okay? Those are similar to stroke symptoms, all right? So you need to check that glucose immediately to rule out a reversible cause, okay? This will prevent delays in that appropriate treatment, okay? So your stroke, when we get stroke patients in the ED, the first thing you do while they're still on the medic stretcher and the doc's talking to them, get a finger stick, all right, and see what their glucose is. So, all right, moving on, question 12. What is the normal fetal heart rate range? All right, this is just normal recall here. Fetal heart rate range. What are we thinking? I see some C's, some B's, row, ethio. All right. The correct range here is B, 110 to 160. This is the standard healthy fetal heart rate range and indicates adequate oxygenation and well-being. All right. So 13 here. Which patient is most at risk for fluid volume deficit? All right. Fluid volume deficit. Is it a post-op day 3, vomiting for 12 hours, mild fever, on diuretics for 2 days? Let's get some answers in the chat here, guys. D, B, B, B. All right. Yeah, definitely, guys. Correct answer here is B, all right, because persistent vomiting causes rapid loss of both fluids and electrolytes. Okay, that'll lead to dehydration, hypovolemia, and metabolic alkalosis if left untreated. All right, diuretics for 2 days, that's sure, whatever. I mean, that's not something that's going to provide the most risk for fluid volume deficit. Okay, all right, so that's question 13. 14. And guys, if you're just coming in, we're trying to get through 60 of these questions in an hour. We're stopping every 10, take a little short break. All right, question 14 here. All right, which sign indicates hypoglycemia? What sign indicates hypoglycemia? All right, I see a few C's, a couple A's. All right. Yeah. All right, guys. Correct answer here is C. All right. Sweating and tremors, anxiety, tachycardia. Those are all autonomic signs of hypoglycemia as that body releases epinephrine to raise the glucose. The rest of those are signs of hyperglycemia. All right. 15. Cold and clammy, need some candy. I like that, sir. I like that. All right, question 15. Which position improves oxygenation? All right, this is about as straightforward as a question as it gets. Yep, definitely. B here, high Fowler's. You're going to sit that patient all the way up if they're having trouble breathing. Okay, perfect. Good job, guys. All right, 16. What color should serous chest tube drainage be? All right, getting a little more challenging here. We see you guys are, wow, C, A, B, B. You guys are all over the place. Okay. All right, so for chest tube drainage, we are going to want C, straw colored drainage. Okay, that is normal serous fluid and it is expected early after chest tube placement. All right, so C, chest tube drainage should be straw colored off the bat here. And 17. Nope, that's the next one. Okay, which patient is safe to discharge? Pneumonia with a fever, post-op with stable vitals, chest pain resolved 10 minutes ago, or DKA with persistent acidosis. Which one is safe? Okay, this one should be pretty straightforward as well. Right, post-op with stable vitals, 100%. That stable post-op patient who meets the discharge criteria, that shows no signs of complication, can absolutely get the fuck out of here. Thank you, see you later. All right, sorry guys, I'm an ER nurse and I was in the military, and so I curse sometimes. So sorry, not sorry. Question 18, which insulin peaks the fastest? Oh, okay. All right, what do we think here? Is it that NPH, regular Lispro, or glargine? No. Somebody said, so basically C and D. D is a long acting. But yeah, the correct answer is C, Lispro. Lispro is going to act within 15 minutes and peaks at an hour. If you guys have a question on insulin timing, I did a video on that. It's under my Vitals in 30 playlist about insulin timing. All right, so go check that out. All right, so 19. Holy crap, we've got 90 people in here? Jesus Christ. That's awesome. All right. All right, question 19. What isolation precaution is needed for measles? We're talking measles. All right. I see B, C, B. Someone says A, contact. The correct answer is B, airborne. Measles is extremely contagious, and it will spread through airborne particles that remain suspended for hours. All right, so let's go back. Question 20, last one here. Not last one, we're doing 60 of these guys, so stay put. We're just going to take 30-second interlude after this. All right, this is the last easy one. Can you see there? It kind of broke off. Which electrolyte imbalance causes peak T waves? All right, I'm seeing B, hyperkalemia. Yep, 100% hyperkalemia. Because hyperkalemia, that's high potassium. All right, so that hyperkalemia affects the cardiac muscle conduction, causing tall peak T waves, widened QRS complexes, and then puts that patient at risk for fatal arrhythmias. All right, so I'm just going to drag this down for a quick sec. So guys, you coming in, I'm Nurse Jimmy, I'm an ER nurse, and I help people pass the NCLEX. So we're going to do a lot more of these in the future. So I have in my link in my bio, you can request a custom study plan. It is a paid resource just because it takes me time to do to help utilize your time. Resources you already have available. You're literally, it's built around your life. Okay, it can't really get any more simple than that. It's built around your life, tells you what to study, takes all the guessing out of it. It's in the link in my bio. And then also you'll have the NCLEX Vault, which is over 250 pages of cheat sheets, mini tests, strategy guides. That's free. It does ask for your email. Whatever, you give your email to any random Yahoo for literally anything. So just pop your email in there, get access to the vault. All right, let's go. Let's do the next 10 here, guys. All right, these are of moderate difficulty, this next group. All right, question 21. This is a mixed set. So Amy asked about anything pharmacology related. I believe that there will be some, but this is just a mixed set of 60 random NCLEX topics. All right, so what do we think here, guys? Post-op client suddenly develops shortness of breath, chest pain. What is your first action here? I see some D's. Shortness of breath and chest pain. All right, so here, the reason it's not D, okay, shortness of breath and chest pain, yeah, you might want to sit the patient up, but you're not going to just walk away and come back in 10 minutes, okay? So your answer here is B, okay? The shortness of breath and chest pain, specifically post-op, that's a key word there, all right? After surgery are classic signs of a PE or pulmonary embolism, all right? And the priority is always immediate oxygen to reduce hypoxia and prevent further tissue damage, okay? So that is why it is B. It is not called a provider. The NCLEX wants you to do something. Is this for, so, you know, LPN, there's a lot of just basic recall stuff in here as well. So some things are going to be more RN focused, but you'll definitely get some value for hanging out. All right, if you guys haven't already, go ahead and share the live down there. Let's get some more people in here to study and like this screen, okay? All right, so B, apply oxygen. That's our answer. Question 22, moving on. Which finding in a child with dehydration requires immediate intervention? All right, which finding in a child with dehydration requires immediate intervention? All right, so here I see a lot of people going B, sunken fontanelle. All right, sunken fontanelle is a sign of what? All right, sunken fontanelle here just means that there might be some dehydration, okay? We got to go back to our ABCs, airway, breathing, circulation, and that cap refill in answer C indicates that there could be poor perfusion or worsening circulatory compromise, okay? That can easily, in a tiny human being, can progress to shock in this pediatric population very quickly, okay? Yay, you got it, yep. C, cap refill 4 seconds because it should be less than 3, right? Airway, breathing, circulation. Dehydration can wait, okay? 23, here we go. Patient DKA being treated with IV insulin. Which intervention is a priority? All right, we know DKA is diabetic ketoacidosis. All right, I see A, B. Let's get a few more answers in here. A, okay. D, okay. So the answer here is going to be B, give potassium replacement. So insulin here drives potassium into the cells, dropping the serum potassium rapidly. So DKA patients often will start with a normal or high potassium, but then become critically hypokalemic as that insulin therapy begins. All right, does that make sense? So increasing the risk then of a lethal arrhythmia. So we need to replace that potassium because it prevents any cardiac complications. So that's like literally a cornerstone of DKA management is that potassium replacement. All right. So yeah, they're getting a little harder, aren't they? All right. 183 people in here. Fuck yeah. All right, guys. If you haven't already, go ahead and share this so we can get more and more people in here. I'd love to be up to 500 by the time this quiz ends. All right. What are we thinking here? Client receiving RBCs. All right. I'm seeing lots of B's, and you would be correct. Okay. Chills and lower back pain. What are they signs of? They are signs of acute hemolytic transfusion reaction, which can rapidly lead to shock and kidney failure. So you want to turn that shit off, okay? Stop the transfusion. 25. All right, which patient is at highest risk for increased intracranial pressure? Go ahead, lay it on me, guys. Let me see it in the chat. Child meningitis, adult with a migraine, elderly client with dehydration, or COPD with chronic cough. All right, be a bunch of A's, D, A. It's 100% A, child meningitis, right? Because why? Meningitis causes inflammation and swelling of the meninges, right? So that elevates intracranial pressure and can quickly worsen to brain herniation. So child meningitis, that's our answer. Let's go, 26. Are we like literally, we started at 9:30, it's 9:56, question 26, we're 26 minutes in. Jesus Christ, I am fucking good. No, you guys are good. We are right on track. 26 questions, 26 minutes, let's go. What do we got? All right, so here, we're talking about chest tubes. The correct answer is gonna be B, air leak. All right, so continuous bubbling in the water seal chamber will indicate air leaking from the system or the patient. So that can impair lung re-expansion. So it's got to be identified and corrected to prevent complications like a persistent pneumothorax. All right, the bubbling should be intermittent, then not continuous. Okay. All right, it's all right. It's all right. Don't even get freaked out. I know a lot of crying face emojis. It's okay. We are learning. This is the space to learn, right? All right. Question 27. Which order should the nurse question? All right. Which order should the nurse question? All right. Here we go. Here was that farm question. You wanted, oh, there's a hint. Is it? All right, people are saying heparin infusion for PE. Nope, that is totally normal to be on a heparin infusion for a PE. All right, it's going to be C, metoprolol for a heart rate of 58. Why? What is metoprolol? Metoprolol is a beta blocker, and it is going to affect and you give it to bring down heart rate and blood pressure. So if that heart rate is less than 60, we're holding it. Okay. So don't be afraid to go to your provider, send them a message, or if you're in ED, you can talk to them face to face. Hey, buddy, you sure you want to do this? All right, question 28. A client with acute pancreatitis reports severe epigastric pain radiating to the back. Which intervention is the priority? Let's go. Which intervention is the priority? Yep. Perfect, guys. B, give opioids. All right, because why? Pancreatitis will cause severe inflammation and often excruciating pain. All right, and immediate pain control prevents shock, reduces stress, and improves breathing patterns. All right, so good job. All right, so question 29. Here we go, guys. If you're just jumping in, we're doing 60 of these. We're only halfway through. All right. A client with hyperthyroidism shows irritability, fever, tachycardia. What complication are we talking about here? What complication are we talking about here? All right, I'm seeing A's, B's. Good. Yeah, here, guys, the answer is going to be B, thyroid storm. So thyroid storm, if you see these signs or you see it in real life, it is a life-threatening emergency, which is characterized by severe hypermetabolism, fever, tachycardia, and agitation. And so without that treatment, it can progress to heart failure and shock. It requires immediate cooling and beta blockers. Cooling and beta blockers. All right. Awesome, guys. Question 30, and then we'll have a 30-second interlude after this question. Which patient requires droplet precautions here? All right. Yeah, guys, 100%. Like if you've spent any time in the hospital, I mean, some of you are saying B, C. Okay, it's going to be C here. Okay. So definitely going to be influenza because that spreads through large respiratory droplets and it'll only travel short distances. All right. So A and D are airborne and B is airborne. TB is airborne as well. All right. 253 people. Holy moly. All right, guys, I'm going to drag this down so you can see my pretty face here real quick. All right, if you're just jumping in, I'm Nurse Jimmy. I'm an ER nurse, and I'm going to help you pass the NCLEX if you're taking it, or if you're in nursing school, great, follow along. If you haven't already, follow me up there. All right, so you get more of this content and you're alerted when these lives happen. 2 things in the link in my bio. If you're studying for the NCLEX, I do custom NCLEX study plans around you, your time, your resources, to your weaknesses. And if you're a repeat test taker, I do it all based off of your CPR and figure those in as well to build you the most customized plan you could possibly have. Also, in the link in my bio is the NCLEX Vault. 250 pages of free cheat sheets, mini tests, quizzes, strategy guide. Check it out. Let's do this. Let's get through the next 30 here. And you guys can check that out later. Again, if you haven't already, give me a follow. All right. So jumping back in, question 31. All right, let me move this more onto the screen. All right, client with cirrhosis has new confusion and musty breath odor. Which lab explains this? All right. So yeah, I'm seeing lots of B's. Yep, definitely, guys. B. So high ammonia levels here will indicate hepatic encephalopathy, which arises when the liver cannot detoxify ammonia effectively. All right, so high ammonia, that's our answer. That's the one we're going with. Question 32. 32 minutes in. Question 32. God, we're good. Okay. Which newborn assessment requires immediate intervention? Let's go. Drop it in the chat. Which one requires immediate intervention? I'm seeing some A's, a lot of B's. All right, for sure. Jitteriness is often caused by neonatal what? Hypoglycemia, okay? It's going to require immediate glucose evaluation because low sugar can lead to seizures. All right, question 33. If you haven't already, go ahead and, like, we're almost at 300. Go ahead and share this live for me. Do me that solid so the rest of us can, the rest of you guys can get in here and do some questions. Let's pass this fucking thing. All right, question 33. Here we go. All right, I'm seeing lots of C's. Good. Yep. Okay. So correct answer is in fact C. So during thyroid surgery, the parathyroid glands may be inadvertently damaged. That could lead to decreased calcium. They're going to feel tingling, and tetany are those classic signs of hypocalcemia. And then left untreated can cause laryngeal spasms. Okay. All right, I know you guys want to see my pretty face, but if I shrink this screen too much, then I'm not easily able to flip through the questions. So bear with me. I know, I'm here, I'm pretty. All right, guys. All right, question 34. Oh, okay, it's showing, sorry, okay. How's that? Still, I'm having my moderator do a little quality control here. All right, sorry guys. It looked good on my screen, so thanks for that. All right, so question 34. All right, correct answer here is going to be B, receptive aphasia. All right, receptive aphasia results from injury to Wernicke's area and causes difficulty interpreting spoken or written language. All right, so we got that. Good job. Question 35. We are now over 300. We've got 308 people in here, guys. Hell yeah. All right. Question 35. Which order is priority to implement for a client with suspected sepsis? All right. We got some A, C, A, B. All right. Yeah. Okay. So this one has divided you more than this country right now. Okay. All of these things you're going to do. And if you're working in a hospital, you've probably done them all at the same time. Okay. But the first thing the NCLEX wants you to do, obtain blood cultures. Okay. Blood cultures must be drawn before antibiotics to identify what the organism is. All right. So any delay in obtaining cultures can lead to misidentification and inappropriate treatment. Okay, so you need to obtain your blood cultures first. All right. Question 36. Let's go, guys. All right. A patient with COPD is ordered 4 liters a minute via nasal cannula. What's your best action? All right. What is your best action here? What is your best action? We see A, B, C, A. Okay, there's a B. A patient with COPD is ordered 4 liters of nasal cannula. What's your best action? Yeah, we're going to reduce that. All right, because why? Because COPD patients, you're going to take away their drive to breathe if you crank up that oxygen too much. So we are going to decrease that oxygen to 1 to 2 liters per minute. Answer is B. All right, question 37. Are you starting to get a little bit harder, guys? Maybe not. All right, so which finding in a laboring mother is most concerning? In a laboring mother is most concerning. All right, everyone's favorite maternity section here. B. Yep, lots of B's in the chat. Or B's in the trap. B's in the trap. Come on now. We're all on TikTok. We know the trend. All right. Yep, 100%. It's going to be those variable decelerations because they indicate umbilical cord compression. Remember that acronym VEAL-CHOP. Literally, guys, I just did a video on this like this week. All right, let's go. All right, VEAL-CHOP. Variable decelerations. C, cord compression. All right, go check out my video if you're having any difficulty on that. All right, 38, here we go. All right, which intervention is essential for a client with SI-ADH? All right. All right, here is C, A, B. Okay, think about this. When you see SI-ADH, guys, I want you to look at those first 2 letters and think soaked inside. Okay? Okay, typically when you see SI-ADH, it's being compared to diabetes insipidus. All right, so SI-ADH, think soaked inside. We're not going to give them more fluids. Okay, versus diabetes insipidus, DI, dry inside. Okay, so you're going to give them fluids, right? Okay, so here in SI-ADH, you're going to B, restrict fluids. All right, because SI-ADH causes water retention and dilution hyponatremia. All right, moving on. All right, if you guys haven't already, go ahead and share the live. Go ahead and give me a like and a follow. All right, question 39. client receiving furosemide or Lasix is at risk for which imbalance? Oh, this should have been in the first 10 questions. This is a gimme. All right, because we know furosemide is not a potassium-sparing diuretic, right? So they are at risk for B, hypokalemia. Question 40. All right. A stroke client with right-sided paralysis suddenly has a productive cough and wet lung sounds. What do you suspect? Question 40. See some B's. Some C's. All right. Answer here is going to be C. Aspiration pneumonia. All right. Stroke clients often will have impaired swallowing, putting them at risk for aspiration. A productive cough and then crackles suggest aspiration pneumonia. Okay. So you're going to need to provide prompt antibiotic therapy here for that. All right, guys. Oh my gosh. We're almost at 400. Almost at 400. All right. If you're any of the 120 somewhat new people who joined in the last 10 questions, I'm Nurse Jimmy. I'm an ER nurse, and I'm going to help you pass the NCLEX. All right. We're doing 60 NCLEX questions. You need to do 3 things. Give me a follow, share the live, give me some likes. All right. Let's boost this up. Let's get to 500 people watching this before the end of the live. All right. If you're taking the NCLEX, I do NCLEX custom study plans based on you, your life, your resources, your weaknesses, your CPR if you're a repeat test taker, and then also the NCLEX Vault, which is 250 pages of cheat sheets, study guides, mini tests. It's all available in the link in my bio. Let's go. Question 40. Let me pull this up a smidge. All right. Question 41. We're doing 60 of these guys, so hang in. All right. You have 4 clients. Who do you see first? Who do you see first? And we've now entered, this is supposed to be the hardest 20 questions of the set, but yeah, you guys are killing it. You guys are too freaking smart. All right, so yeah, correct answer A. That new restlessness, that should be a red freaking flag. All right, when you see those words. Post-op, day 1 with new restlessness. Hell yeah. All right. So, question 40. Oh, we're a minute behind schedule. No, we're right on time. All right. Question 42. A trauma client arrives. They're hypotensive, tachy, cool clammy skin. What type of shock are we talking about here, guys? What type of shock are we talking about? Lots of C's. All right, a couple A's. Yeah, we're talking hypovolemic shock here. So that low BP, higher heart rate, cooled, clammy skin will indicate that sympathetic activation due to fluid or blood loss. All right, and this type of shock is common after trauma, and we need to give fluids, maybe blood, okay? And we need to recognize this rapidly, or it could result in irreversible organ damage. Boom, 43. Client with TPN develops crackles and dyspnea. What is your priority? What? Thank you guys for the follows, Angelise. What is... Okay, we've got a couple saying slow the infusion, a couple saying stop the infusion. Those are probably the 2 obvious answers here, okay? The correct answer here is going to be B, slow the infusion, all right? Crackles and dyspnea, they do indicate fluid overload, okay? That is a known complication of TPN. Why? Because of its high osmolarity, all right? So slowing the infusion reduces further accumulation while you just assess the patient's respiratory status, all right, and that can prevent the progression of pulmonary edema, okay? So slow the infusion, that's what the NCLEX wants you to hear, all right? Thank you guys for the follows. If you guys haven't already, boom, give me a follow. That's the fastest way I can grow this thing and do more of these. Thank you for the roses, guys. Gifts are appreciated. All right. That one we just did. 44. All right. Labor and client has late decelerations. What is the best initial intervention? Best initial intervention. All right. I see a lot of people wanting to turn that patient onto their left side, and you would be correct. All right. So late decels signify an issue with the placenta. All right. Placental insufficiency. So meaning the fetus is just, they're not receiving adequate oxygen during contractions. And so repositioning will improve blood flow to the placenta, and it's the fastest corrective action. All right. The other interventions follow if that repositioning does not correct the pattern. All right. So, all right, question 45. All right, so you are caring for 4 clients. Who's the highest priority? Let's go, guys. Drop it in the chat. Which is the highest priority here? Question 45. C, B's, D, C. All right, here the answer is going to be B, okay? So that decreased wheezing and asthma suggests the airway is so tight that airflow is barely moving. So that's indicating impending respiratory failure, okay? This is more dangerous than audible wheezing. So you're gonna have to do an immediate assessment, and intervention are probably gonna be required here to prevent an arrest, okay? Again, thank you guys for the follows. If you guys haven't already followed, definitely hit that follow button. Appreciate you. All right, 46. Patient with suspected meningitis has petechiae on the trunk. What is your priority action? Client with meningitis. What are we thinking? All right, a few B's in the trip. Sorry, I'm not gonna get that out of my head. B's in the chat, geez, B's in the chat. All right, yes, guys, thank you for the follows. Yes, it's gonna be B here. Okay, so that petechiae combined with the suspected meningitis suggests like a meningococcal infection, which is highly contagious and rapidly fucking fatal. Okay, so let's go. 47. Okay, join fan club if you want, guys. All right, a client in labor has ruptured membranes with a fetal heart rate of 90. What do you do first? All right, we have 13 questions left. If you're just joining, we're going to 60. All right, we have 410 people in the chat. Hell yeah, let's go. All right, so a client in labor, 47. Correct answer here is actually, guys, going to be B. All right, we're going to check for cord prolapse. Why? Because a sudden drop in fetal heart rate after membrane rupture strongly suggests cord prolapse. So physically checking and relieving the cord pressure is the fastest and most effective life-saving response. Usually then they're going to go for a C-section. Okay. 48. All right, a client with Addison's disease is found unresponsive and they're hypotensive. What is the immediate intervention? Okay. Oh, Mermaid Jen, I love you so much too. Heart face. What are we doing here, guys? Addison's disease. I see B, A. Okay, yep. All right, guys. Yeah, you're a group divided right now. So answer here is going to be A. In an Addisonian crisis, all right, it's life-threatening cortisol deficiency that leads to profound hypotension and electrolyte imbalance. So IV hydrocortisone is the critical treatment here, okay, because cortisol is essential for maintaining vascular tone and blood pressure. Boom, laying it on you. We are studying. We're doing study stuff here. Hell yeah. You guys are so smart. All right, 49. A ventilated patient has high pressure alarms. What is the likely cause? High pressure alarms. Is it a disconnection, cuff leak, mucus plug, or empty humidifier? Yep. All right. Good job, guys. Most of you are getting this. It's going to be C, that mucus plug, right? Because the air is not getting past that mucus plug, creating high pressure. Okay? And that is literally, when you hear that high pressure, it's the most common thing going on. It obstructs airflow. And so then suctioning is usually, not usually, suctioning is going to be the thing that you do right off the bat. First thing. Question 50. A patient with sepsis is receiving norepinephrine. Which finding is priority? Which is the priority here? Cold extremities, decreased urine output, red streak. Interesting, guys. So, we might need to brush up on our norepi. I don't think I've seen the right, there, Lisa's got it. The answer is going to be C here, guys. A red streak near the IV site. That is going to be our priority because what does it indicate? It indicates extravasation of the norepi, okay? Norepi is a potent vasoconstrictor, okay? So that can cause severe tissue necrosis, so you need to stop that effusion immediately so it prevents further damage, okay? Critical medication safety issue. So brush up on your norepi or just commit this shame that you're feeling right now to understanding the red line. All right, it's honest says, I knew that. All right, guys, go ahead and follow. All right, was that question 50? Oh yeah, okay. Little interlude. We're at 460. We're almost there. Guys, go ahead and share this live. We're almost there. We got 10 questions left. Let's get over 500. 3 things. Follow if you haven't already followed. Like the live. And then in the link in my bio, I've got 2 things. Custom study plans for you. They're based on you, your resources, your time, your weaknesses, your CPR if you're a repeat test taker. Holy shit, we're over 500. That's available in the link in my bio, as well as a free NCLEX vault is what I call it. It is over 250 pages of pure genius. Okay, so there's many tests, strategy guides. It's all yours. Just go, it asks for your email, but literally you give your email to everybody and their mother nowadays. So why not give it to me? Love you guys. All right, let's bang out these last 10 questions. Question 51. All right. Which client is most unstable? Oh, I love these questions. Let's go. Which client is most unstable? I think I need to get to the bottom of my chat. There we go. If you want me to look at your CPR, go to the link in my bio, and happy to make you a custom study plan based on your CPR. All right. Here, guys, the most unstable patient here is going to be D, that chest pain radiating to the jaw. All right. It is a classic sign of heart attack, myocardial infarction, MI, whatever you want to call it. All right. And time to treatment is literally critical in preserving heart muscle. Okay. Cellulitis, no. DKA with potassium of 5, yeah. Stroke symptoms started 5 hours ago. You can't do it. You can't do anything with that. Treatment is basically blocked at 4.5 hours. All right. So chest pain radiating to the jaw. Boom. 52. Oh, we're a minute behind schedule. We got to go. A client with renal failure has a potassium of 7.2 and peak T waves. What's the priority? Potassium 7.2 and peak T waves. All right. Yep. I'm seeing it. Seeing lots of it. So yeah, C, give that IV calcium gluconate. So calcium gluconate stabilizes the cardiac membranes immediately, which buys time while the other potassium lowering measures work. So if you're in the middle of doing a hyper-K protocol at work, in the hospital, calcium gluconate is the first thing you're going to do. Okay? There's usually an order set that says, do the calcium first. All right, question 53. 7 more, guys. Let's go. 444 people in here. You guys are amazing. I love you. All right. Let's see your answers. 53. Yep, I see B's, I see D's. B, B, D, D. All right, you guys are split between B and D, it seems like. All right, here, right now, the tracheal deviation here is the sign here. You need to know your signs and symptoms of a pneumothorax because tracheal deviation is a hallmark sign of a tension pneumothorax. So that is where the air accumulates under pressure and shifts that mediastinal structures. So that trachea, when you're looking at your patient, your trachea is deviating to the good lung. Whichever lung is still inflated, that's the way your trachea is deviating. Okay? So B is the answer, tension pneumothorax. You guys are right. Why does it say it says my live is going to end in 5 minutes and I need to complete a puzzle in order to keep going? What the hell, TikTok? Okay. All right. We need to storm through this, guys. We're almost question 50. All right. Which finding indicates neurogenic shock? Let's go. We need to pump through these last 6. Neurogenic shock. All right. The answer here is going to be C. All right. Neurogenic shock occurs when that spinal cord injury disrupts any sympathetic tone. All right. Instead of the tachycardia seen in other shocks right now. So patients present with bradycardia and hypotension, all right, due to that unopposed parasympathetic activity. All right. And yes, I'm married. All right. Question 55. A client with cirrhosis vomits bright red blood. What's your first action? Cirrhosis, vomits bright red blood. All right. Okay. Yep. A, start a large bore IV. A is the answer because that bright red hematemesis suggests that they have some esophageal variceal bleeding, which is rapidly fatal without aggressive fluid resuscitation. So, boom. Question 56. I'm going to jump to 57 because I want to get to 60. A patient with suspected PE suddenly becomes hypotensive tachycardic. What is the first intervention? Let's go. What is the first intervention? B, D, 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 B, 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 B. Yep. All right. So B the answer is B. Massive PE causes acute hypoxia due to the obstructed blood flow. So answer there is going to be B. Question 58. Yep, there it is. Okay. Client with myasthenia gravis becomes very weak after taking medication. What complication do you suspect? Myasthenia gravis. All right, see B, C's. Correct answer here is in fact B. All right, the cholinergic crisis. Okay, excess cholinesterase inhibitor medication will lead to a cholinergic crisis, which then causes profound weakness and risk of respiratory failure. All right. 59. All right. Client on warfarin has an INR of 8 and sudden flank pain. What should you prepare for? Warfarin, INR of 8. Yep, I'm seeing some B's, some C's. Definitely B, vitamin K. All right, an INR of 8 with flank pain suggests internal bleeding, likely retroperitoneal or renal. Okay, so that vitamin K reverses that. All right, last question here, guys. Question 60. A trauma client, absent breath sounds on the left and distended neck veins. What is your priority? All right, B, 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 A. All right, correct answer here is A. All right, so when we see these absent breath sounds plus distended neck veins, the classic sign again of a tension pneumo, where we might also see that tracheal deviation. Okay, rapidly fatal condition and needs needle decompression. All right, guys, that's it. I think my live is probably going to self-end here in a minute. If you haven't already, go ahead and follow. Check out some videos. I did an awesome Girl Hit the Wham video on a test-taking strategy that you should all memorize and commit, because you can take any of these questions and pick a winner here. All right, so thank you guys. If you all joined, go ahead and follow. Check out the stuff in my bio, the custom NCLEX study plans, the NCLEX Vault, which is free. Just put your email in there, whatever. So yeah, I'll stay on here until they kick me off. So you guys are awesome. When do you? I'm going to be more regular with it. I don't have a set schedule, but if you follow me, check my story. I will post in my story when I'll be going live that day. So you can even go ahead and register. It's free. So just go ahead and register, and then TikTok will send you a notification saying like, hey, Nurse Jimmy's live now. Go ahead and jump in. All right. So do you do private mock exams? I mean, the resources that I have in the NCLEX Vault are going to be, there's lots of mini tests, and I'm going to be adding a comprehensive mock exam to that as well. So that's definitely reasonable. What other questions you guys got? A lot of my content is RN based, but a lot of my fundamentals, delegation, all that stuff is also PN as well. And if you need a study guide, a custom study plan, again, found in the link in my bio, I can do PN study plans as well. So, yeah, so check that out. They are $20 just because they take me a little bit of time to do, but I'm really good about getting them back to you within 24, 48 hours. And again, they're based on you, your resources, the stuff that you already have access to, and your weaknesses. It asks a decent amount of information, so it's just important to be as specific as possible. And I can tailor that specifically to you. It gives you a Monday, Tuesday, Wednesday, Thursday, Friday breakdown of what to study when, based on weaknesses, to make sure you come back better for the test. Can you please do exam mock for me, an exam mock based off your CPR? If you just want that, I mean, you could honestly just upload your CPR into like ChatGPT and ask it to provide you a mock exam. Do you do this often? It will be. I'm going to do this a couple times a week. I think that this was pretty successful, evidenced by having over 500 people in here. That literally like blew my mind. So yeah, absolutely. Taking NCLEX on Thursday. So what is today? Today's Tuesday. Yeah, I actually have a video. Go to my NCLEX playlist, my full NCLEX review on my profile. Go scroll all the way down to the bottom. There's a great video. I think it's great. At least I've gotten some good feedback on it. Important to watch the night before. But honestly, you could binge my playlist. It just has a lot of high yield tips in it. People have told me, I've gotten DMs, hey, I stumbled upon your TikTok the night before the exam and I binged all your videos and then I passed. I mean, they probably did a lot of work beforehand. Any tips for ATI proctor's exams? I'd have to kind of dig into that a little bit more. I don't have anything like right off the top. I mean, a lot of these exams follow a pretty systematic approach when it comes down to breaking down questions. So utilizing the action strategy, ACTION. I have that video in my profile. It's the very last video that I just did. You'll see me like, girl hit the wham, because I have a 13-year-old daughter and she showed me that trend, and like, I can make a video of that. And so I embarrassed myself. Me like, girl hit the wham, because I have a 13-year-old daughter and she showed me that trend, and like, I can make a video of that. And so I embarrassed myself, but I don't give a shit. So you can utilize that strategy, commit it to memory, and you can break down any question, ATI proctored exam or not, and just kill it. Seriously. So yeah, if you guys are still in here and you haven't followed me, please go ahead and follow. I'd appreciate it. It helps me out, helps get the channel out there so that we can do more of these. Yeah, all right. So I guess TikTok didn't kick me out at an hour, so that's cool. Awesome. Thank you for following me, Isabel. You guys are awesome. I'm thrilled with how this turned out. I hope you guys found it valuable. Perhaps like we can do like themed questions, like maybe like really hit a subject hard if somebody wanted to do that. Hamdi, I'm a repeat test taker. Please help me pass. Yeah, the best way I can help you pass is creating you a custom study plan, which you can find in the link in my bio. All right, awesome. It was great, very helpful. Thanks, Isabel. All right, yeah, MedSurge, definitely. And I might do like chunks of questions. Like I think maybe 160 questions of one subject might be a little bit much, but maybe I could do like a bulk, like here's some MedSurge, here's some, I'm trying to keep it more or less NCLEX focused, but anything NCLEX focused, it still teaches you how to answer questions like you would see on nursing exams, right? So, yeah, I would say, so just join in. A lot of my content is not just teaching the material. It's learning how to answer these questions, how to attack them. And yeah, so this is, I like teaching, but hey guys, I've got an ADN, okay? I'm not like some fucking nurse wizard here, okay, who just knows a lot of shit. I just like to learn and I like to teach. So I love nursing. This is this is a passion for me. This is a fourth career for me. I started nursing school at 33, and it was a journey. I have a video pinned to my profile, which basically shows you in video form my journey. But I was in the military, did some jobs that I've just felt like I had to take, and then eventually found nursing. But yeah, I felt like this was a good format, like with the questions on the screen. I've seen some people do lives where it's like the phone, they have their phone like aimed at their computer screen. It looks kind of weird. At least I thought so, but you know, I thought it was good. What are the questions you guys have? Probably got maybe another 5 minutes or so. I have to work tomorrow. Little 7 a.m. to 7 p.m. What else? Yeah, I'm an ER nurse. Been doing this for a few years. Again, this is a fourth career for me, so I've been a nurse for like since 2022. I'm a resource nurse. I don't do tutor per se. I'm toying with some ideas about doing like small group lives that are maybe like, I don't know. I haven't worked out yet. Maybe like a subscriber type of live for like a small group at a time. I don't know. Haven't figured it out yet. I don't have a specific time yet. I'm gonna probably hash that out on when I go live, Fiona. But if you follow me, just make sure you do. So when you open up TikTok, and I'll have a new story. And when days I do go live, I'll put it in my story for you. And then you can register. So then free, right? You just hit the register button, and then TikTok will remind you whenever I come on live. Hey, Nurse Jimmy's live. Okay. Plan on teaching nursing? No, I don't feel like, in order for me to teach nursing formally in a school, I would need at least a BSN, and I don't even want to get that. I think I don't want to go back to school. I would rather just do this. You guys are awesome, and I can kind of do a little bit of a side hustle. You know, I think that this is where I'm meant to be. I like doing my ER nursing gig, and It's great. I love it. I love that. I love, I did a little bit of acting back in the day. So being on camera is not something I'm totally unfamiliar with. So I enjoy this. If you could just see around me, I'm like just literally sitting in my house by myself, just talking to a phone. But I don't mind. It seems oddly familiar and normal. Yeah, I think that there's too much of a nursing shortage for all nurses to need a BSN. They're just trying to get people into school right now, period. I don't know, Isabel, I haven't really looked into it as far as like teaching PNs with an ADN. Don't know. You'd have to look that up. Not 100% sure. Yeah. So guys, sorry for those of you who just joined. We just did 60 NCLEX questions, mixed topic. So if you're interested in something like that, we'll be doing it more throughout the week. So just go ahead and follow. And then register for my live. It'll be in my story on days that I do it. So I wouldn't see. I think I could probably try to do this again tomorrow. But check back, follow, and then check my story, and I'll post it if we do go live. But thank you guys so much for joining. Really appreciate it. I thought this was pretty successful. So. Opinion on Mark K lectures. I mean, some people swear by them. I did it the first time. So I took the NCLEX. I liked it so much I took it twice. I failed the first time. I did Mark K lectures the first time. They work for some people. They don't work for other people. But I mean, I also felt like looking back, my plan was kind of faulty. I could have prepared better than just trying to do it on my own and listen to Mark K and the other, what people would call the gold standard of NCLEX prep. But I hope to be sometime worked into that conversation. But you still need a master's if you want to teach. Yeah, fuck that. I'm not doing that. Definitely not getting a master's degree. I already have a bachelor's degree in biology, and I am not doing anything else. So, all right, guys, to the remaining 83 of you, if you haven't already followed, go ahead and follow. I'm going to peace out. I got work tomorrow. So you guys have a great night. It was a pleasure. All right, take care.